Hello, my name is Samuel Marquard, and I'm here to talk about universal health care in the United States and why it matters. To begin, I'd like you to envision a health insurance company. Regardless of what you envision, whether it's the things on screen or not, all health insurance companies in the U.S. have something in common. You must pay for that health care. Let's first talk about the current healthcare system in the United States. First of all, we must understand that the U.S. does not provide free health insurance for all Americans. This means that most Americans must use their own wallet to get care. Most Americans have health insurance, which, while helpful, often comes with surprise fees that can lead to financial pressure. Many Americans, though, especially the poorest of our country, are uninsured, and being uninsured in the United States causes great financial stress as hospital bills, care prices, and drug prices are very high. There are some options for free health care in the United States for the poorest, sickest, and oldest in the U.S. However, these systems, while being very good at their job, are not set up for all people and will never be able to support a whole healthcare plan. Although this system sounds bad, many Americans have this ideology that paying for your own health care insurance matters, since the U.S. has a pay for yourself and only your immediate family cultural norm, and many think that paying for other people in their health insurance would not be beneficial. But I am here to argue that this is not true, and that free health care for all in the United States would help everyone and our country. I now want to explain in detail how this system harms our citizens and our country as a whole. First of all, our current system greatly causes financial strain and stress for Americans. Medical finances and fees is the leading cause of personal bankruptcy in America. Our current healthcare system also causes many Americans to become sicker due to the fact that they delay treatment because of the finances that come with our system, which causes many Americans to have drastic medical problems that go untouched before they finally get treatment. Next, this system causes much debt that Americans must have to pay off over time. As well as it hurting citizens, this system hurts our country as a whole. The United States spends more money on health care than any other country in the world. And this current healthcare system is not set up for great financial or medical strains, such as recessions or pandemics, as how we saw the COVID-19 pandemic affected our country drastically. I even have heard a story of how the healthcare system affected a nurse practitioner's patient. She told me how her patient attempted to fix a tooth that was hanging out of her mouth because she didn't want to have to pay because she was in financial need. So she tried putting a garlic clove to keep her tooth from falling off her gums. The solution I propose to our current healthcare system in the United States is universal health care coverage for all. Universal health coverage implies that all people have access without discrimination to nationally determined sets of needed promotive, preventive, curative, rehabilitative, and palliative essential health services, and essential, safe, affordable, effective, and quality medicines and vaccines. while ensuring that the use of these services does not expose the users to financial hardship, with a special emphasis on the poor, vulnerable, and marginalized segments of the population. Universal healthcare needs to have automatic enrollment, free care, a fixed budget, basic coverage, and supplemental coverage. I also encourage that our system will help the most in need and most vulnerable be supported, because our current healthcare system often discriminates against those groups. So, how will the system look and function? How will universal healthcare succeed in the U.S.? I propose two possibilities for a good system in the United States. Either a single-payer government-run system where everyone would be covered without barriers, or a pluralistic system with a combination of nonprofit, for-profit, and government payment. Either system has good benefits and downfalls, but without a doubt, either way, it would benefit Americans. Many argue that universal health care would greatly cause more financial strain on the government. However, statistics support that the U.S. would be able to raise universal health care and finance it without major changes to taxes or government debt. Either way, we need to simplify, give free care, and reduce the drug prices in the United States. So, how will this system specifically help Americans? Well, first of all, it will greatly reduce financial stresses and strains that Americans face. Since it reduces these financial stresses and strains, many Americans will quit delaying health care, which will cause many lives to be saved, since diseases in Americans will be caught earlier and treatment will be given to citizens sooner, which will likely reduce the death toll in our country. It will also reduce gender, financial, and racial disparities from occurring in the healthcare system, because everyone gets an equal opportunity to face care. It will also protect the Americans who need it the most and provide them with support for long-term care and treatment that they need the most. It may also greatly help our country, such as reducing the effects of a global pandemic by allowing quick testing and news about the pandemic to spread, and may possibly reduce hefty prices, even in billions, that the U.S. currently spends on healthcare. Taiwan's healthcare system is a great example of how its coverage helps many, such as allowing easy care and cheap costs to all. This is where I leave it to you, my audience. I call on you to help support universal health care in the United States. I, for one, am not 18 and cannot vote. Voting is a great way to get universal health care in the United States to pass. It's often beneficial that we elect new politicians that support universal health care than try to convince current ones. So voting for candidates who advocate for policy for universal health care is a great way to support the cause. Another method, even though it may not work, since, like I said, it's hard to get politicians to change their mind, is to send letters and attend meet and greets to encourage current lawmakers to support universal health care policy in the United States. With enough effort, we as Americans can get universal health care in the United States and help everyone in the United States in some way or another. Thank you for listening to my presentation. I hope that you now care about universal health care in the United States and wish to go out and support universal health care policy. I ask that you like and potentially subscribe to my channel so that my video can get to more people and that this universal health care idea may become reality in the United States. If you want to learn more about universal health care and why it matters, see some of these articles that are on my Works Cited page. My name is Samuel Marquard. Thank you for listening to my presentation.